Let's get more on the coronavirus now, with the World Health Organization declaring the outbreak to be a pandemic and growing case numbers around the world. And of course, those measures that we've just heard announced by President Donald Trump from the Oval Office. Here to look at what this means and how the virus is spreading is Dr. Meru Sheel from the National Centre for Epidemiology and Population Health at the ANU in Canberra. Dr. Sheel, welcome. Should the WHO have called this a pandemic sooner?
Look, I think it doesn't really change much in the way we respond to a public health emergency and an outbreak. The word pandemic can be associated with fear, so I think agencies making those decisions are best placed to make those decisions, but from a public health point of view, it doesn't really change how we prevent and control and implement outbreak response measures for outbreaks of this kind.
So just looking at the spread of the virus here then, what are your thoughts about the pace of that spread, which seems to be increasing dramatically day by day?
Yeah, look, I think like a lot of outbreaks, it is spreading quite quickly. We probably haven't seen a virus spread so quickly. We definitely haven't seen pandemics caused by coronavirus before. What we have seen is that this is a highly infectious virus, so what we really need to be focusing on prevention and really stepping up the preparedness across the world to make sure that we can prevent the spread and really not overwhelm health systems as much as possible.
Well, the Premier of Victoria, Daniel Andrews, has already foreshadowed extreme measures being taken in that state because of the virus. Gladys Berejiklian has said much the same sort of thing in New South Wales. At what stage might we see mass school closures, bans on mass gatherings in some of our major cities here?
Look, I think it's a fine balance. I think obviously the priority from a public health point of view is still containment. I think that's always the first approach. If you identify, your system should be strong enough to detect and identify a case. When you identify a case, the best way to contain it is to isolate the person, treat the person and follow up their contacts, and really using a ring-fenced approach to actively find as many infected people as you can, isolate them, treat them, and then look at their contacts. It's a really fine balance between when you move from a containment to that mitigation or wider measures, which can have wider impacts on society and the economy of a country or a city. And I think that has to be decided case by case based on what the transmission is looking like. And but I think as long as we can follow the public health principles and prevent the spread, that's probably still the best strategy.
Onto the case around the world then. There have been questions about how the virus has been handled thus far in the United States, and now we've had these measures from Donald Trump, travel restrictions among them. Is the virus out of control in the US? Has it gone beyond containment?
Look, I don't think I can comment. I'm not in the US, so I can't really quite comment on that. But I think what we do know is that we need to test widely. Our surveillance systems need to be really strong, and we need to be able to detect and diagnose as many cases as possible, because unless you diagnose the cases, you can't really isolate the ones who are infected and then prevent the spread. So I think you need to test widely. Travel measures can often, travel restrictions can delay an outbreak, but it can't prevent an outbreak, as we've seen. And so I think stronger within country public health measures are really important everywhere at this stage.
And just finally, when do you think this outbreak will peak here in Australia and also overseas, if you can answer that one?
Oh, I think that's a tough one. I think what we are seeing in a lot of countries is that the virus, once the infection number, it's a fine threshold after which the systems get flooded and the disease tends to spread faster. So I think this whole, for the last couple of days, we've all been hearing about flattening the curve, and it really still follows that principle of applying public health measures so we can, it might seem like, you know, it's lasting a much longer, but we really need to contain the spread as much as we can, use health promotion measures such as personal hygiene, respiratory hygiene, staying at home if you are experiencing flu-like illness. If you think you might be infected, with this coronavirus, then call a hotline, call a GP ahead and follow your local guidance from the state and territories. So I think following those measures, but it's kind of hard to predict when it will peak here or globally. There are still about 60 countries that haven't seen a case, so we're still to see what's to come. So it's difficult to predict right now.
Of course. Dr. Meru Sheel, thank you.
Thank you.